On thumb CMC joint risk and overuse. And obviously, I'm Brett, the only one presenting this. Just to touch base on one thing before we continue on into the slides, I'm kind of having some malfunctions with PowerPoint here where it is just randomly skipping the slides. So if that occurs, I'm going to quickly shoot back to the other slide and continue on with what I'm talking about. So just bear with me if we do have a little bit of technical difficulties. So just a couple objectives of our presentation. We want to learn what the CMC joint of the thumb is. There's an example of it right there. I'll cut back as soon as I can. We want to develop a better understanding of what osteoarthritis and carpal tunnel syndrome is. Which occupations are more prone to developing these specific types of impairments. Tips on how to combat/manage symptoms. Understand the risks of long-term use and how to take action to combat wear and tear, and also some insight into possible surgical intervention and recovery expectations. So what is the thumb CMC joint? The thumb carpal metacarpal joint is a saddle-shaped joint at the base of the thumb. Specific joint connects the trapezium to the base of the first metacarpal bone. It's a saddle-shaped joint classification, which essentially means that it allows for forms of multiple movement in multiple planes. There's just a couple of quotes that I had from some direct sources that are provided at the end of the presentation, and it's that the thumb CMC joint experiences up to 13 times the amount of force transmitted at the tip of the thumb. Then also the anatomy of the thumb CMC joint, as well as the force transmitted through it, makes it makes it extremely susceptible to osteoarthritis. So that's why we're kind of highlighting this specific thumb joint itself, because from those statistics or from those specific quotes, we can see that long-term use of this joint, we're at a better risk of development of these impairments long-term down the road. This is just a slide kind of breaking down, just showing a visual representation of the different types of movement that this specific joint allows for people that don't necessarily understand the specific anatomical or motion terms. All right, so then some susceptible occupations and symptoms. So occupations that are reliant on thumb motions, specifically such as pinching, grasping, or twisting. Jobs that are focused on manual use, highly technical, and precision-based outcomes are at high risk for long-term impact. And some long-term symptoms/impact include numbness and tingling, weakness, joint stiffness, pain, and aching. So now we have some examples of those specific occupations that are more susceptible to developing issues within the specific joint. So medical field, dentists, dental hygienists, and surgeons. You think gripping those tools, very precise, precision-based outcome when taking care of patients. Skilled trades like electrician, plumbers, and carpenters. We have the picture of the carpenter there and hammering in a nail. You think about that shock and that blowback of hammering the nail and the recoil that that tool gives on that specific joint itself. Service providers, hairdressers, and waiters. And then kind of the other category where it loops in musicians, or artists, people that are a lot of painting, sculpting, also gardeners and landscapers. So then what is osteoarthritis? It's defined as a degenerative joint disorder caused by the gradual breakdown of articular cartilage that cushions bone ends. Osteoarthritis of the thumb CMC joint is typically caused by age deterioration, repetitive forceful gripping and pinching. So kind of those specific thumb motions that we were talking about in the previous couple slides. And then also symptoms of osteoarthritis in the thumb CMC joint include inflammation, stiffness, and reduced range of motion. And kind of the big highlighted bold piece of this slide, obviously at the bottom, is there's no known cure for osteoarthritis. That's why it's important to highlight now, because we want to take combative steps to prevent developing an impairment like this, because once we have it, there's no getting rid of it. There is managing pain and symptoms, but without that high-end surgical intervention, there really is no way to get rid of this specific impairment. So then what is carpal tunnel syndrome? And carpal tunnel syndrome is defined as the compression of the median nerve in the wrist. Symptoms include pain, tingling, numbness, muscle weakness, and pain ascending up the arm. And then causes of the syndrome include repetitive forceful wrist motions, previous injury history, swelling of the tendons in the wrist, and arthritis complications. So this next slide is kind of a breakdown of how does osteoarthritis and carpal tunnel syndrome coexist. And it's the development of osteoarthritis in the hand and wrist causes inflammation and swelling that decreases the amount of space available in the carpal tunnel. And then carpal tunnel syndrome, at its most basic definition, is the compression of the median nerve itself within that carpal tunnel in the wrist. While these two impairments have different causes and effects and different pathologies to why these may occur, people who develop osteoarthritis in the thumb CMC joint of the hand are more likely to develop carpal tunnel syndrome. And that's why we have the picture on the side here that kind of gives you the breakdown of the overlapping symptoms, where they're not the exact same thing, but like I previously stated, having osteoarthritis in that thumb CMC joint has a higher likelihood of also developing carpal tunnel syndrome itself. So next we have some managing pain and symptoms and preventable actions based upon your occupation. Strengthening exercises of the muscles around the joint help stabilize that joint. Supportive braces. Take breaks from pinching/grasping to let the joint rest. And then also modifications of tool use. Like I said, talked about high precision based outcomes. Think with those dental hygienists and surgeons again, having to be very precise and cautious when dealing with patients. So increasing the grip diameter of these tools or adding padding to the tools can help lessen the amount of stress and the less compression that you have, which would then result in long-term complications down the road. So then managing symptoms as well. Splinting, once again, supports the joint and helps reduce inflammation. Some sort of splint to hold it in place, so you're limiting that range of motion. Also, compression gloves, which can help eliminate and decrease the amount of inflammation within the area. Heat and ice helps reduce pain, relieve swelling, inflammation as well. Over-the-counter medications, ibuprofen, pretty self-explanatory for that one as well. So next we have a couple examples of some surgical interventions. So we're going to touch on two, one specifically for the carpal tunnel and one for the thumb CMC joint replacement arthroplasty. So click on this video here for you.
I also do endoscopic carpal tunnel releases. Now, what is that? That's by doing the procedure, same idea, we're releasing the transverse carpal ligament underneath the skin, but instead of doing it from the top down, we are doing it through the bottom up. And so what I do is I introduce through a little incision still, but smaller, offset. I do it in the palm, some will do it in the wrist crease, but we get under the tunnel, and then we look up with the scope. We can see the fibers crossing above us, making sure that there's nothing in the way, no nerve, no tendon, nothing. And once we see those transverse fibers, we can take a small blade and we release it from within. And so by doing that, that allows us to release the entire carpal tunnel without making a big open incision.
All right. So then next, we are going to be looking at our thumb CMC joint replacement arthroplasty.
Did you know that your own tendon can be used to replace an arthritic thumb joint? Arthritis at the base of the thumb is one of the most common types of hand arthritis. Over time, the cartilage that cushions the joint wears away, causing pain, stiffness, and difficulty with everyday tasks. Thumb-base arthroplasty offers relief by replacing the damaged joint with the body's own tissue. After making a small incision, the surgeon removes the arthritic bone. Then, a nearby tendon, usually from the wrist, is rolled into a soft cushion and placed where the joint used to be. This tendon acts as a natural spacer, preventing bone-on-bone contact and restoring smooth movement. Once the procedure is complete, the hand is placed in a splint to heal. With therapy, the thumb regains strength and flexibility, allowing patients to return to daily activities without pain.
All right, so then next we're going to just kind of highlight some pros and cons. Just one specific example of each because, like I said, we're kind of on a time crunch. A pro, I found this from a specific study. Trapezium resection with or without tendon suspension, arthroplasty, has been considered to be the gold standard surgical treatment for thumb carpal metacarpal joint osteoarthritis. Why would we indulge in this surgical intervention? Like I said, there's no known cure for osteoarthritis. So this is kind of like the final step, the final progression within your recovery. Cortisone shots haven't worked. Over-counter medications, splints, everything that you try at-home remedies that is not working, that is not a surgical intervention, this is kind of the final step in the decision process where you take that long-term recovery road, but in the end, you may be thanking yourself for it. And just to kind of play devil's advocate here where we have a con, we have another study. At 3 years post-operatively, the annual health care costs and utilization for surgical patients were less than those for patients who underwent conservative management, but this difference was insufficient to offset the initial surgical cost. What does that mean? Essentially, surgery is expensive. Long term, like I said, this is why this is usually one of the last steps that you want to take, is because the con is it costs a lot. in long term, you may want to do these at-home remedies, and you may want to do everything to try to combat your symptoms. A lot of people don't want to deal with the whole recovery process of surgery. They're scared of it. And that's just one of the cons, is the overall cost is kind of on par with that long term. But long-term result 10, 15, 20 years down the line that you may have after the surgery, it may be more beneficial to get it than it was to continue to try the at-home remedy, especially if your symptoms are not getting better. For our final slide here, we have a Q&A with my mom. Like you can see within the title slide, this video is 8 minutes long. So for that reason, I'm going to have to cut this out. Here's just a couple of examples of her home exercise plan, what people can expect with their recovery if they choose to go through with some of those surgical interventions that I just showed on the previous slide. Also here we have a picture of my mother's beautiful hand right after surgery. So that's kind of glaring to show you the types of effects that you may be expecting post-surgery. But that link is clickable to go watch the YouTube video that I made. So I highly recommend that if you are considering that surgical intervention, you see firsthand experience of what my own flesh and blood has had to deal with, firsthand experience, and you can decide if this is worth the risk or not. So some final key takeaways. Occupations that involve pinching, grasping, and twisting are more likely to develop carpal tunnel syndrome or thumb CMC joint osteoarthritis. Resistance training, supportive bracing, icing, and heat are examples of simple solutions that can help limit risk if you don't want to indulge in that surgical intervention. And then also surgical intervention isn't necessary, but it can be a long-term solution. And some final advice to wrap up the presentation from a physical therapist: take care of your body before it's too late. Be cognizant of your body mechanics at your own profession. Listen to your body when it's telling you that something is wrong. Take care of yourself before it's too late, before you even have to go down this road. Thank you. Citations.